what we say fractures of the lung bone. 80% of abusive fractures are in children under 18 months of age. The more ambulatory a child is, the more they are able to move around, the more they horse play in the playground, they will have and can have a high risk of fractures just through accidental trauma. But when you're talking about abusive injury, in terms of fractures, most of these are under the 1.5-year-old time period. 2% of accidental fractures are in children less than 18-month-old. Why? Because usually they're not ambulatory. They don't move around. A child will start moving around at 4 months of age. And how do they do that? By rolling over, right? If you put an infant, a 2-month-old or a 1-month-old in the middle of the bed, and the parent or caretaker comes to the emergency room and says, I put her in the middle of the bed, I did everything, but then the child fell to the floor and now has this injury. How did that happen? Because they cannot roll over. They can wiggle, they can move around, and if they're at an edge of, say, the bed or a changing table, certainly they can fall if they're 1 or 2-month-old just by wiggling, but from the middle, being in the middle of the bed, rolling over, that does not happen until 4 months. And then cruising, standing up, holding on, trying to cruise around on furniture is usually after 6 months. 7 months, 6 to 7 months when they can sit without support. After that, they will start becoming ambulating and cruising, and usually it's a very slow, wobbly process that if they fall on their tushies, or they can have some trauma, but there's no velocity associated with this, so that accidental trauma is very low, the risk for that. Occult and multiple fractures. Occult means they can have a fracture, but you don't know about it. And this is very common. A child can have a fracture from inflicted trauma on their legs and their arms, and because they're not writing, they're not in school, they're not using their arm to throw a ball, they're not walking even, they might just be cranky, and it might be interpreted as fuzzy, crying, colicky baby, hungry, not sleeping well, has a cold, but they do have a fracture. And this usually happens under the age of mostly 18 months. We do screening for fractures 2 years and under. This is a picture of a rib, a chest x-ray showing you a rib fracture. So essentially, the bones are not connected here. You can see a displacement of this piece of the bone near the center of the body, as opposed to this one. Acute rib fractures will look like this. Now, when you do a repeat film, as these things are healing, there's bone formation, calcium deposition, so you can actually pick it up on an x-ray as a big ball of bone, if you can say, calcium around this, and that would be a healing fracture. If you don't see that here, this happened pretty acutely within less than 7 days. By 7 to 10 days, you might start seeing some healing, and that will give you some reference as to timing of an injury. This is a long bone, okay, of your extremity. We have here a lucency, something that looks like a bucket handle. A bucket handle fracture or corner fracture, depending on the way the x-ray is taken, the projection of the beam of the actual x-ray, it might look different. Here's a bucket handle, or it can look like a little corner chipped out of the bone. These injuries are more the result of traction in an extremity, torsion of an extremity. So if the explanation doesn't involve those type of mechanisms, then you worry about inflicted trauma. It's not just going to happen by a child walking and falling regularly unless there's a twisting type motion and traction applied to the extremity, to the joint. So we have to be getting a comprehensive history as to what would happen. The primary imaging study for the investigation of physical abuse when you have fractures in kids this age group, under 18 months, under 2 years, yes, is a skeletal survey or an osseous survey. What that is specific images of the parts of the bone. And of course, everybody's concerned about radiation, but if the likelihood of inflicted trauma is high, this offsets that risk. Because if you find more, and sometimes we do, repeated other healing injuries, other acute fractures, it just gives you a better picture of what happened to the child because they can't tell you. They're nonverbal, and sometimes they can be acting regular even when they have healing injuries. Usually we'd repeat the skeletal survey in 2 weeks because this just allows you to pick up trauma that might be acute but not seen, and you will see it when it's healing because of all the calcium that gets placed. The bone scan is just an imaging study that lights up because of inflammation, and that can help. It's just an adjunct exam to help you pick up abnormal findings in your bones. Now, for example, we have this child. We have some injuries to the eye. It looks like a toddler or an infant or a preschool child, right? Non-ambulatory. But is this concerning for abuse? Just think in your mind, is this abuse or is it accidental? It could be either. But in this case, you can see here a big bruise to the forehead. Normal bruises in children will happen over bony prominences. What that is, areas of bone that have skin. For example, in a child that's starting to ambulate or walk, and in kids that can walk, forehead gets injured very easily. Cheekbones get injured very easily. Elbows, shoulders, hip. The hip joint right here, this bone. If you have trauma, rough play, wrestling, whatever, you might have a bruise right over your bony prominences. This child, forehead trauma or injuries to the face can actually, the blood, which I'm sure all of you have seen, that collects in the forehead, can come down to the tissues around the eyes and give you this raccoon eye appearance or black eye appearance or purple, blue eye appearance like in this picture, but it's not because the trauma was here. It could have been, but most of the time it's because it tracks from an injury up above. So you can have tracking of that. And the finding of this bruise might be helpful to determine that. It's not that on the case. Can you be hit here and here too? Of course. But you have to take the history into account of what could have happened to this kid. So something that looks so severe might be accidental in nature. On the contrary, you have a child that's clearly an infant with this bruise. And what this is showing is what we call a pattern bruise. What does that mean? It has a shape. You can see here it has these little lines and this big yellow-green appearance. In the past, we used to say that if a child came to you with green, purple, brown, yellow, and many color-type bruises, the injury was because of repeated assault, repeated trauma. But now we know that you can have actually all the colors in the spectrum except for yellow and brown presenting in a child, and depending on, like I said before, the color of your skin, the depth of the injury, or what happened and what area of the body is involved, it might be red, it might be purplish red, it might be blue, it might be just green. And that could have happened from a single assault or single traumatic event. Yellow, however, usually after 18 hours, you might see yellow. Brown is usually a resolving bruise. So those are clearly older injuries. But yellow, green, purple, or red, you can't say one came before the other and this is older than the other. In this case, we have a pattern bruise and what it looks like a handprint. This is actually skin that is not bruised. The bruise is in between the digits. So when you slap a child with the hand, the skin that goes between the digits will get compressed and you can have vasculature damage there. You can cause the appearance of a hand or the digits of a hand. This area right here is actually skin that's pretty normal, where the digits are. So that actually, even though it impacted the head, did not leave a bruise. It's the edge in between the fingers that left the mark. Now, is this accidental or inflicted? It's not self-inflicted, we know that. Could it be accidental? It could be accidental. In what way? Well, what if there's a sibling who has developmental disabilities and slaps the kid? All right? We wouldn't consider that inflicted trauma in the sense that it's intentional to cause that kid harm, but there is clearly an accidental injury, and then we move into where's the supervision of the caretaker. So we move from physical abuse maybe to a neglect type of issue, especially if it's repetitive and it happens over and over again. So it might not be as clear cut, but in this case, a perpetrator can slap the kid, live in a mark, inflicted trauma, because that is not going to happen just because. What do we have here? Additional trauma. You see this? Red, purplish blood inside the ear. Nothing on the pinna, nothing on the external canal, it's right there, internal. Here we have the same, different child, more extensive bruising. Okay? If we have a history compatible with that, that is an accidental mechanism, great. If they just said the kid woke up like that and has this bruise, that is concerning. Children might not disclose what happened, or they might disclose, depending on how fearful or who was the perpetrator in the case. But this is definitely concerning for somebody impacting the ear, and you might not necessarily get involvement of the whole ear or even the face, just the areas that receive the most force and show the broken vasculature. Impacts to the ear might be associated with intracranial bleeding on the same side. We have something that people call tin ear syndrome, where you have ipsilateral, same side, intracranial bleeding from a force or a blow to the side of the face, which can present just with ear findings. But then you have to look deeper inside and sometimes scan this kid, especially if they have symptoms of neurological alteration. Vomiting, they don't feel good, they can't remember what happened, anything like that. We scan and we do a complete evaluation of the children. What about this? Petechial bruising on the face. Same thing, broken blood vessels. You know, this is very common in our nurseries when babies are born, for lesions to be on the face just because maybe the cord is wrapped around their neck and they have force applied to the face, and you can have broken blood vessels like this. That's very common in the nursery. If this child presents like this to school, say, and she doesn't provide a history, it's concerning. It's not in the rest of her body. It's just localized to her face. How can that happen? What force can break the blood vessels in your eyes and in your face? Well, if this child has a medical history or coughing like pertussis, which is like whooping cough, you can actually cough and have such a forceful cough that you will break vasculature in your face only. You can have a history of forceful vomiting and retching because of a bad gastroenteritis. That will also even break blood vessels inside your eye, meaning in the white of your eye, subconjunctival hemorrhages. Like this. But this child might have presented to an emergency room with, she just woke up like that. That is not a history. And if you see, there's like a line of demarcation here, which could have been the result of strangulation. Increased pressure. So we have to match the presenting findings with what they're saying happened to them. If there's not an explanation, it is suspicious. If the kid is not sick and there is no medical reason for the injured blood vessels, it is suspicious and more has to be looked into. But physical abuse, like I said, you have the injuries in front of you and you have to work backwards to determine what could have caused this in this child, this age, at this time. Here we have another type of injury. Could have resulted from a spanking, it could have been with a hand, it could have been with an object. Why is it that we don't see any findings here, in between the butt cheeks? Most likely because the child was tying up the buttocks, and this area was protected. So you don't see that. Okay? You don't see any involvement because it was not hit directly. But you can have spanking like this. Is this abusive in nature? Yes, it is abusive. Too much force. This is not a simple spanking. This is corporal punishment, discipline that is concerning for being abusive in nature, angrily. The perpetrator might have lost it, caused too much force to break all and injure all those blood vessels. This is just blood. So when we do anticipatory guidance to the parents, because we do see regular pediatric children, we tell the parents, listen, a colicky baby, it is okay to call a neighbor or a friend and have a break. Because it can be very hard on the caretaker of a child that's crying constantly. If you think you are angry because of something that happened and you can't control, you have an anger